Let's talk about this with Niall Dickson. He's Chief Executive of the NHS Confederation, representing NHS Trust. Good morning to you, Niall.
Good morning.
Look, a lot of us were a little bit, should we say, pessimistic about the government's chances of creating its own app. World beating, we were told by Matt Hancock. And I remember saying to him myself on air, why don't you just use the one that the tech companies have come up with? Theirs was going to be better. It was going to be centralised. It was going to be do so many better things than those apps. Now it turns out it doesn't work. And small point worth making, doesn't work, so no use to any of it. It's great, it just doesn't work. And now they're going to work with Apple and Google. They say Apple apparently have said the government hasn't said to them they're going to work with them. They knew nothing about this, and we don't even know when it's going to happen. Can we get out of lockdown and make sure the NHS isn't overwhelmed with new cases of coronavirus if we do not have a working app for test and trace?
I think we probably can, but we need a test and trace system which is working much more effectively than the current one is able to operate at. And that's obviously, it's quite new and it's starting to develop, but we need to get that figure up. As you say, around a quarter of people are not being reached. And remember, of course, those are only people that we know have tested positive. There are lots of people who've got the virus that we don't know. So we're not reaching, as I understand it from the public health experts, we're not reaching enough people to suppress the virus at the moment. And of those that we do manage to contact, we're not managing to trace enough of them. We need a higher figure of the numbers that we manage to go through. That does not necessarily require an app. Remember that this contact tracing business has been done by public health for many, many years without apps. And of course, the telephone is a huge advantage here in terms of contacting people as well. But so does shoe leather work in this sense as well, having stuff on the ground. So,
we were told the app was vital, and then we were told, but it doesn't work without human beings. And that was crucial in places like South Korea, where you actually had to have an army of people who made the phone calls. But it's one thing not being able to get all the names of everyone who someone has been in contact with, who's now infected with the virus and confirmed with the test, and or some people not replying to phone calls. How is it possible not to be able to contact a quarter of the people who've actually tested positive for the virus? Surely those people had to give their details at the point when they got the test.
Well, I agree, and I think the short answer is they are still developing this whole process, and it's obviously going to, as ever. The problem is that politicians tend to overpromise and underdeliver, and what they need to do is the other way around. Yeah. And of course, as you say, and social distancing is the critical factor, I think, here. It's not that we can't loosen up bits of the economy, but the economy, including healthcare services as well, I think, are very much affected by social distancing. So we need, if we have a social distancing regime in place, which I think we do need now, given the virus is still around, it still has the potential to jump back up again, that will constrain how far we can reduce the lockdown. So that is the balance that ministers have to do. And of course they're in a hurry, and they want to say, the trouble is they always want to say optimistic things instead of saying, well, we're going to look at this, we're relying on old-fashioned contact tracing, but we are looking at an app, but apps carry problems, but we'll let you know. Instead of saying that, of course, they say it's going to be world beating from the beginning of June.
Yeah, and they're setting themselves up for failure. But you mentioned, social distancing, how crucial it is. I do think as we come out of lockdown, a lot of us, and I consider myself one of these, you kind of forget, I've been in my home for months on end, other than going to the supermarket and going out for walks. Well, when I go out for a walk, obviously come back and wash my hands, but I've not touched anything other than, my husband or my daughter's hand or the car if we've driven somewhere. And I obviously wash when I come in from the supermarket, but we're perhaps not used to, the mask wearing, the constant hand washing and the social distancing if we have been at home so much. And we're going to really need to sort of go back to that, because there's lots of evidence, isn't there? When you actually look at the spike we saw in infections and in death, that this relates to the few weeks before we went into lockdown, that actually we were already seeing a fall in infection rates and a fall in people who would then later go on to die, just simply from people distancing themselves, people not being able to go to the pub, and people, basically people going to work, going home, washing hands, not having contact with people unnecessarily, and actually that is the number one thing that will keep us safe.
Yes, it will, and I think that's absolutely right. And one of the difficulties is, just as you say, the sort of binary advice of stay at home or don't stay at home. So stay at home is simple and so forth. As soon as you start to ease the lockdown, then it all becomes a little bit more common sense, dare I say, and a bit of people being aware. So touching things, I think, is probably the area that we haven't really talked enough about, and as well as keeping social distance. And the social distance rule, I think they will look at again, and whether you can nuance it. I mean, I see in Northern Ireland, obviously, they've gone for children at school down to 1. Yeah. But also, if you're facing away from me, I'm much less likely to give it to you than if you're face to face.
Or even just simply alongside or diagonal, and we just need to be given all these detailed bits of information, don't we? And so we can learn to work with it and get back to some semblance of a real life, which is what people want. Niall Dickson, Chief Executive at the NHS Confederation, always good to speak to you. Thank you, sir. 7:16.